The Treatment Action Campaign was launched to protest the government's refusal to distribute ARVs and has since been credited with forcing the government to do so. This was at a time when the country and the world was fighting another pandemic, the spread of HIV and AIDS. They have since launched a survey to ensure quality health services during COVID-19. And to unpack this, we are joined by the National Chairperson of the Treatment Action Campaign, Sibongile Tshabalala. Good morning, and thank you very much for joining us. Now, Sibongile, you've raised concerns about whether or not people living with HIV and TB are getting access to adequate health services during this lockdown in particular. Why is this a concern for you?
It's a concern for us because we know that people living with HIV or TB, if they don't get their medication, as much as we are fighting coronavirus or COVID-19, but we will lose more of people living with HIV and TB if they are not getting their treatment adequately this time of COVID-19.
How do you think pandemics such as COVID-19 perhaps perpetuate some of these social fault lines inherent in our system and our country at large? I mean, ultimately, what lessons from COVID-19 can be, implemented that we have perhaps learned from HIV and AIDS and the treatment thereof?
One, it's working together. We need to learn that, and that is the biggest lesson that I think the government hasn't yet learned. When we need to talk about people on the ground, because all our studies and researches, we are doing them at the national level, but looking at the ground, it's a total difference of what is happening. So we are happy now that the screening is going down on the ground, but then we need to work together as civil society or health groups to be able to cap the fight against COVID-19. So that's how we manage on ARVs. People on the ground, people affected, they were part of the struggle, they were part of the fight. Hence today we are regarded as a country that is doing well on HIV ARV rollout.
Looking back at just access to resources, for some time, we understand during 2019, there was some shortage of ARVs in the country for people who most needed them. To date, is this still the case? What has transpired on that front?
Yes, the issue of ARV stockout is still the case, although it's not like it was in the 2019. What is happening now is that we see people are being given 1 month treatment, 2 month treatment, and we advise the government to give people at least 3 months treatment for this time, so that people they will be able to get their medication in time and be able to take their medication as they are supposed to take. So that's what we are worried about at this moment.
You mentioned community solidarity and working together is quite pertinent during this COVID-19 lockdown. And you're also conducting a survey, which you're going to be drawing on some of the experiences from people in trying to understand the current system, the health system in particular, and what is of most concern. I mean, how exactly will this be happening, and what does that look like?
Okay, the survey that we are conducting, mostly we are focusing on people living with HIV and those who are taking TB treatment. So what we are monitoring is that people are still getting their treatment as they are supposed to, because we don't want to fight one battle and lose the other battle. So while we are fighting COVID-19, we felt that it is important for people living with HIV and TB to be always adhere to their treatment. As we know that COVID-19, it mostly affects people who have respiratory problems. So TB, it affects your lungs. So if you are not taking your treatment adequately or correctly, it means you'll be affected with COVID-19. And you know that people living with HIV, immune system is compromised. So that is why we are focusing on people living with HIV and TB. Also, our survey is focusing mostly on that they're getting their treatment, and we want to see how people are how people feel at this time, especially those who are living with TB and HIV. And this survey is so anonymous. You don't have to fill your name. We just need that data so that we can be able to scale up our work. Remember that we've been doing this as people living with HIV, and we will continue to do this.
Sibongile, how is the survey going to be conducted? In which areas will you be visiting? And then once you've actually received the results, I mean, what are you going to do with it? Where will it be published? What recommendations are you hoping to set forth from these results?
Okay, this survey is conducted in 8 provinces, actually in 9 provinces. So, and we tend to take this data and send it to the Department of Health so that they see how are they doing or how are we doing as a country during this time. And this is our learning. And honestly, we are not doing practically, but we are doing it online. So we have sent it to all our contacts and distributing everywhere so that people, they can fill this data. This data will be shared with the Department of Health and with the country, so other implementing partners. So we are planning that all this data, it will be made public so that people will see how we have done and how people are sharing so that we know where are the gaps and we are able to deal with the gaps where it's necessary.
Sibongile, we know that immunocompromised as well as people with respiratory issues are the hardest hit, particularly during a COVID-19 pandemic that we've seen. Looking at some of the interventions that are needed, all right, we seem to have lost Sibongile Tshabalala. She's the National Chairperson of the Treatment Action Campaign. I'm being told that she is back. Sibongile, if you can hear me, I was just picking up from where we got disconnected. As we know, the issue of immunocompromised and people living with respiratory issues could potentially be the hardest hit by COVID-19. And in view of this, I wanted to know what are some of the interventions, needed going forward in terms of access to some of the medicine for people with HIV and AIDS. I mean, are these services still available to the public at clinics and hospitals? How does that look like at this point?
Yeah, at this point, everything is still going according to the plan and well. People are still getting their treatment, as I've said earlier, that they are getting treatment, but then they are getting 1 month treatment, especially for HIV. And people with chronic diseases are still taken to CCSD sites. So what is happening now? For now, we are still okay the way things are because no one has left the clinic or the hospital without medication. So that's what we want to keep things in the country. Hence, we are continuing with this survey. Hence, we want to continue to do our monitoring.
Sibongile, as the survey, gets underway, just looking at some of the recommendations as it stands, whilst you wait to conduct the survey and perhaps look at the results thereof. I mean, what are some of the interventions you recommend at this point, particularly to those most vulnerable?
What we are, the interventions that we've been working on, we are working on the simple version of COVID in our lives, that we want to distribute it online and publish it in few days. So that booklet or that COVID-19 in our lives, it's going to be translated in all languages, 11 languages, South African languages, and we want to distribute it everywhere. And other areas, our branches, they continue and our provinces to communicate on media so that people, they should adhere to their treatment and also continue to stay safe during this time.
So in conclusion, I just want to know what the TAC's position on the development of a COVID-19 vaccine, which could either be produced locally or abroad, for that to be rolled out in Africa or South Africa. What is your stance on that?
We as TAC, we welcome anything that will come and help us, but then these issues of that the vaccine will be tested in Africa and whatever. I don't think that we, as Treatment Action Campaign, we have much to say on that, because we understand the issue of medicine development and research, that even the testing, how it needs to happen. And we know that it cannot just be done in Africa, where the COVID-19 it's affected the whole world. So we know that our genes at some point, they are not the same, that we don't react the same way in medication. And we know, we trust our government and SAFRA that they won't allow any irregular testing or illegal testing to happen in South Africa or in Africa. So we are hoping that AU is looking at these issues, and they will take a decision that will favor people of Africa.